Healthcare District Board of Directors meeting to order at 6 o'clock. Item B. Agenda is distributed.
I will move to approve the agenda.
Is there a second?
Second.
Okay. Moved by Director Bush, seconded by Director Montez. All in favor?
Aye.
Aye.
Any opposed? Okay, we have an agenda that passes. Item 1 is the flag salute, and Director Parks will lead the flag salute this evening.
Place your hand on your heart, repeat with me. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mr. Gordon, would you give the invocation tonight? Thank you.
Heavenly Father, we come before you this evening just as a group trying to make right decisions for the healthcare district. We ask that you just be with us as we go through these decisions, and we ask that you bless them, and we just ask that you be with us. Care for those that couldn't be here tonight. Care for those we are caring for in our different and various departments in the hospital. We ask this in your Son's name. Amen.
Amen. Thank you, Mark. And item 3 is the mission statement, and Director Cassis, if you would read the mission statement this evening.
This is the mission statement of the Kern Valley Healthcare District. We will provide high-quality, efficient patient care services that respond to community and provider needs. We will provide leadership in health promotion and education for our patients, residents, medical staff, employees, and community throughout the district.
Okay, thank you, Director Cassis. Item C is public comment. Is there any public comment this evening? Don't have much public tonight.
We appreciate the public who do that.
Item D is the consent agenda. There's 2 items that we're going to take off. One of them is under contract renewals. Item K, that's going to be tabled once again to the next board meeting because they're still doing some contract negotiations there with Dr. Montez. And then I found out that on page 46, the scholarship application, that has been withdrawn. So item K will postpone until next month, and then we're going to take off the scholarship application on page 46.
And the issue there is not that we withdrew that, the employee requesting that
Yeah.
decided not to go.
I stand corrected, thank you.
Just want to make sure.
So with those 2 changes, is there anything that the board would like to pull from consent? Or if not, then is there a motion to approve the consent with those 2 changes?
I move that we accept the agenda as amended.
Okay, it's been moved by Director Cassis. Is there a second?
A second.
Seconded by Director Bush. Any further discussion? Hearing none, all those in favor?
Aye.
Any opposed? Okay, that passes. Thank you. Item E is the reports. Item number 1 is the foundation report. Ms. Hess. And yes, if you have anything to say, please go to the podium so Mr. McGarrett can hear.
Good evening. The Heart Walk is just around the corner, so again, I passed out a paper there for anyone who's interested in sponsoring. It's February 23rd. We're really looking forward to it. Tentatively, March 1st, we have an open house at the pharmacy down on Mount Mesa Road. Hopefully that might get rescheduled, but right now it's tentatively for March 1st. And we're just looking forward to the new year. We are also looking to apply for another grant from Kern County Health Systems for the diabetic. Are there any questions?
Any questions for Ms. Hess?
Is the open house dependent on the construction, the reconfiguring, and is that the play?
We're working with the county. We're doing a joint open house.
Oh, okay.
So if the first doesn't work out, then we're looking at March 23rd.
Okay, gotcha.
And hopefully that will be completed at that time too.
Yeah.
Any other questions? Thank you.
Questions? All right, thank you, Ms. Hess. Item 2 is the auxiliary report. Ms. Rubert, welcome.
Thank you and welcome, good evening. Well, we have 3 teams ready for the Heart Walk. We're sponsoring
Yay.
3 teams, yay, and we can't wait. They're all getting real excited. Next week is our volunteer luncheon. It's a membership tea. You're all invited to join us. I'm making blueberry cheesecake.
That's enough for me.
You're all welcome to come for that. And that concludes my report unless you have any questions, but I would like to say one other thing. My granddaughter here had access to your telemedicine group last month in January. Awesome experience.
Glad to hear that.
Are there any questions for Ms. Rubert?
And when did you say that he was?
Next Wednesday, the 13th.
Okay. Thank you, Cindy.
Thank you.
Item 3 is the medical staff report, and Mr. Gordon is going to give the medical staff report this evening.
Is this on?
You might blow his ears out.
Good evening. Yeah, I've been asked to provide the Chief of Staff report without compensation that he gets, so I just wanted to make that clear. So the Emergency Department Committee met on January 4th. The committee discussed a policy on revision of a policy on procedural sedation and proposed some protocols for nurse intervention for the triage nurses. The committee reviewed various monthly and quarterly reports and studies, including statistical reports, ED, clinical quality, chart audits, blood culture analyses, and other things. Medical Executive Committee met on January 8th. One credential file was reviewed and approved for reappointment. That would be Dr. Liu, who supports our laboratory. Committee also discussed 2 policies currently in revision. One of those was the procedural sedation policy, and then the other was the standard medication administration times. The results of the medical staff elections were revealed, and there are no changes in the medical staff leadership. The committee also reviewed regular reports, action reports, plan of correction reports, and things. The Infection Control Committee met on January 18th. Regular quarterly and monthly reports were reviewed. Monthly hospital-acquired infections, blood culture analyses, environment of care compliance rounds, clean trace audits, MRSA surveillance monitoring, Foley catheter usage, and hand hygiene compliance. We also discussed local current outbreaks of influenza and strep. The next committee was the Utilization Review Committee. On January 24th, committee discussed issues regarding denials of payment and payment authorizations. Committee also discussed the new requirements regarding the discharge of homeless patients. The committee reviewed regular monthly reports. The SNF CQI, the Continuous Quality Improvement Program on the Skilled Nursing Center, met on January 24th. They discussed 2 policies currently in revision, the resident-directed medication times policy and the standard medication administration times policy. If you need explanation, I can give you an explanation on that, but I'll move on. Regular reports were also reviewed, the CDPH plan of correction tracking tool that we use. Several of those things we have met our required time on. We've solved those issues, and so we've been able to take those off of that tracking tool.
Just for example, when we report back, when we get a plan of correction from CDPH, we, as part of that plan, we have to identify a means where that our results are reviewed by the quality program. And typically we will put in there that we will achieve 100% compliance with that for a certain period of time, 6 months, a year, or whatever. And so what he's referring to is that a number of these measures that we've been tracking have all achieved the 100% requirement that they need, and we're now dropping those from review. We will come back periodically to review them to make sure that we are still compliant with them, but we're not going to be reporting them every month. So.
Right. And lastly, for the SNF CQI meeting, we also discussed the SNF antibiotic stewardship program, which is held in conjunction with that meeting. And we talk about the antibiotic usage over on the skilled nursing center, and then trends on different bacterium that may be treated, and what is the best antibiotic to use in that antibiogram, we call it. So the Pharmacy and Therapeutics Committee met on January 25th. That committee reviewed and approved 6 policies: medication administration times. You'll see a kind of a trend here, won't you? Resident-directed medication times, rapid sequence intubation, patient admission process, the assessment and discharge planning of inpatients, and aftercare instructions. And one protocol was discussed, the norepinephrine administration policy was discussed. The annual formulary review was conducted. One formulary request was withdrawn. They were requesting to remove Demerol from our formulary, but there is one place in the hospital that still uses that product. So we're going to use it in a limited capacity, and that would be the surgery department. A proposed update to the pediatric crash cart contents was reviewed and approved. Regular quarterly and monthly reports were reviewed. And finally, the surgery committee met on January 25th. That committee discussed current QI projects as far as improving patient compliance with their home medications. In other words, if somebody is told not to or to be NPO after midnight for a certain procedure, they're still instructed to take their blood pressure medicines, and half the time they don't take those too. So the tracking is to make sure those patients are following the instructions that they're given. There is continued discussion about revision of our consent forms in that department. We also discussed surgery workflow. We reviewed 2 policies. One was approved, and the other was there as FYI regarding the patient admission process. That is the medical staff report, if there are no questions.
Are there any questions for Mr. Gordon that he can answer on Dr. Finstad's behalf? No?
All right, thank you.
Thank you, Mark. Item 4 is the Chief Executive Officer report. Mr. McGlue.
Great, thank you. Again, we're just going to give a quick update, and I'm going to ask Greg if he would be happy to do this, just to give you a quick update on our mobile clinic and where we're at with that. We had an opportunity to go out and do a site visit this week or 2 ago, and I will let him update you.
Yes, sir.
All right, you can come over and stand like Vanna.
He's got to talk into the mic, though.
Here.
Okay.
They can hear you.
All right. So this is advertising brochure. They basically take this to trade fairs from the company that we chose, LF Group, AGI. So yeah, we had a visit down to the facility last week or the week before. 2 weeks ago, almost 2 weeks ago, and we looked at the facility. Bob Easterday, Tim, and I, as well as Terry Hurley, our clinic coordinator, went down and just took another look at the plant. Actually, I was the only one that saw it before. Very impressive. I think Bob and Tim would say the same thing. So we are looking forward to working with them. We have had some minor changes in the floor plan, so I'm waiting for the revised floor plan to come back, and then the hard drawings will be made for all of the specific, every wall, every power outlet, plumbing. We'll approve all of that. We saw a few that were at various stages of production. The first one we looked into was a dental unit that was pretty close to going, and it was gorgeous. It was truly gorgeous in there, and it was actually better than any of the units I saw previously. So I was pretty impressed. It actually reassured me that we did go with the right company, and I think that things will do well. We're looking at right now, if everything stays on track, a July 23rd delivery date. I wouldn't be surprised if that got pushed out, but I think that it's doing really well. I had a meeting last week with several people from both Kernville Union School District and South Fork Union School District. Basically, in some ways it was an early meeting, in other ways it was appropriate timing because we need to start working on how this unit's going to function on the schools, and they're just tickled to death about the project. We brainstormed a lot about how we're going to see this being used at the schools. And there's such a huge need there, mostly with mental health, but also with doing physicals, immunizations, immunization clinics, etc. So I think that's kind of where we're at with the project. This, here these are. This is a blood mobile that you see here. These are all the phlebotomy chairs. Down here at the bottom is a picture of a dental unit that they have. It has the wheelchair lift on it. So I'm looking forward to working with them. I think it's going to be a great thing. We're working on the credentialing and licensing portion. It's a bigger job than I thought it was going to be, but we're working through it. And Barbara's already started doing some of the stuff for me today. Kind of dropped that on her. So, but we're doing well. So the two aspects of using this unit, number one is licensing, which basically says that this can be used under the hospital's license. That's a little bit more straightforward. The more complicated part is the certification, the Rural Health Clinic certification. So that's the more intense part. That's what allows us to have the more premium type billing. So that's what we're working on. Unless there's any questions or.
The air conditioning, there's 3 units there. How is that self-contained?
They are. The unit has a 10,000 watt generator. There are 3 air conditioner units. They do that, number one, for redundancy, number two, to allow, because it is a mobile unit, doors open and close, so temperature variations are going to happen. We have the unit that we chose. These will have both air conditioners and heat pump, so it'll do both heating and air conditioning. The heat pumps are not true heaters, so it's possible if it's a cold time like right now, we may need to use some adjunct heaters, but for the most part, that's kind of how it's set up.
I think the one thing that impressed me was the quality of the workmanship and the quality of the materials that were used. Very sturdy. Again, just probably one of the better ones that I've seen, in my career and stuff like that. So I think we've made a really, really good choice from that perspective. And we're going to be involved in the design process and throughout the entire process. There's lots of opportunity for us to have input into this, and it's designed, the outlook, the print on the outside, and all those kinds of things. And so we're going to be all working with everybody on that as well. So. Bob, anything you want to add? Or
yeah, it's just it's very impressive. The entire frame is welded aluminum, and all wiring, everything is run inside the walls. Rigid insulation, aircraft grade aluminum, interior, exterior skins. Just very well put together.
Good.
Yeah. I have a few community presentations coming up. So we were going to do one on Friday, but that one got canceled. So I'll be going to the Exchange Club. I'm going to the South Fork Union School District meeting either in February or March. So if there's any other places that we should present this, because number one, we want to present it to the community about what we've worked on so far, but probably more importantly is finding out what the community wants or needs. We're open to suggestions because we don't have a solid business plan about how it's going to work in the community part. I think the schools we're pretty set on, but we still need to work on the community aspect of using the unit.
Well, we've been approached by some groups that obviously they would love to have them come and visit. My thought would be to have this obviously at the senior centers periodically for checkups and those kinds of things. We've talked about, I know the Board and Cares, Burlington and so forth have asked, it'd be great if we could have that there, so they could run their patients through a clinic type setup there. So again, we're exploring lots of opportunities for how we can use this. So I think it's limitless. I mean, there's all kinds of things we can do with that. So,
yeah. Yes.
Dr. Montes?
Can you tell me, do you have a cost of ownership breakdown?
So right now, the unit itself is right at about $320,000. That's the bid that we signed. We found that with the initial proposal that we submitted, it did not include ADA accessibility, and it's very difficult with these types of units because there's nowhere that it says you are required to do ADA, but we know that when we receive federal funds, there's going to be that onus on us for doing ADA. We did make that change. The board approved the contract for Whipfleet to do the application for rural health clinic status. And we'll have most of the unit is pretty much ready to go other than our supplies. We have certain things that we'll need to add into the unit to meet the requirements of rural health clinic status. So we have certain required tests that we have to do, so we have to have some machines to do that.
Outside of what is composed within the unit, what about cost of insurance? Things of that nature?
I don't know about insurance. Maybe Barbara or Chet could address that, but we're
Because
it'll definitely be a rider. Yeah.
You'll also need insurance not only for the vehicle itself, but also for the patients with whom.
Yeah,
are
it'll definitely be a rider on our existing policies. I think we have seven vehicles right now in our fleet.
Yeah, and they're all insured by one company, and so this will just be an added vehicle. Obviously there's a cost to it, yes.
But that would be true if we added another clinic somewhere as well, so, I mean, but we'll have all those questions. Yeah, no, it's a good question.
Yeah. So it was neat going to the place and definitely seeing the dental units. That's once we prove that this is a successful project. That's my next. So maybe in a year and a half, I'll be talking about adding a dental unit. So that's.
Well, there's nobody up here that's doing Medi-Cal dental right now, and that's one of the things that we've been talking about through a number of the state agencies and so forth, and there's a huge need for that stuff. So there's a couple of them that are being looked at right now, and so that's something, like I said, that we can kind of keep on our radar for the future. If this works out and financially pans out and stuff like that, there might be some other options for us to do that as well. So.
And Greg, you said it was July was the tentative date, somewhere around
right
there?
Now, July 23rd, it's supposed to be in our hands, but things happen. Production, sometimes gets put out. The chassis hasn't even been received at Aleph Group yet. So when they receive the chassis, all of their units, they're one of the few facilities that's licensed by Ford to actually extend the wheelbase. So it extends the wheelbase backwards. So when you're making turns, you don't have this huge tail that's coming around and makes it more difficult and more risky to drive because hitting things is always a possibility. It's a vehicle that's gonna move around a lot. It'll be parked right next to the existing rural health clinic. We're gonna have a water electricity dump station basically set up there. So
nice.
We'll be good.
Try not to take out any stop signs.
Yeah.
Any other questions for
Beautiful.
Greg Davis before Tim continues with his CEO report? Mr. Pickering?
How many of these have been bought so far? Just one?
With us, just this one. This is the first project that we're doing for mobile.
And it's already been purchased by the district?
Yep.
We've paid our
It's not
initial
exactly.
deposit. It's being custom built for us, so we've paid the initial deposit. The other, the terms are 50/50, 50% on order, 50% on delivery.
And the minimum cost is gonna be right around 300 grand?
I believe 320,000 for the unit, and yeah.
And who's paying for it?
It's-
Taxpayer?
No, it's coming out of
Operations.
generated funds from operations. So because this will operate like a rural health clinic, So rural health clinics are different than a regular doctor's office because we agree to see Medicare patients, we agree to see Medicaid patients, which in our state is Medi-Cal. So we agree to abide by all of their rules and regulations. In turn, we do get a higher reimbursement per visit. One of the biggest uses of the clinic will be on the school campuses. The school campuses, the students that we come in contact with are going to be predominantly Medi-Cal, so we'll have a higher rate of reimbursement. They anticipate that our what's called PPS rate is going to be the same rate that we have in our existing clinic, which is a very good rate. So there is the initial purchase price, overhead operation prices, costs are really pretty low.
Well, this is a revenue generating project that we did, and the payback on this is pretty quick because of the reimbursement rates that we've got.
Thank you.
Sure, you're welcome.
Thank you, Les. Thank you, Greg. Tim, if you want to go on with your CEO report?
Sure, just, we've had a meeting.
I'm sorry, Nicholas, do you need Tim to move the mic back? Okay.
That would help, I'm sure. Working with Clinica Sierra Vista, we had a meeting recently with them to begin talking about behavioral health services. We want to begin, obviously, looking at all of the providers up here as we, are continuing our work on our community health needs assessment and those strategies. We met with Chris Riley and to talk about some issues. I think they're more than willing to work with us, and so we're moving along that path and having some ongoing conversations with them to see what's possible. We had Cal Mortgage here as part of our finance committee. This is kind of the annual meeting we have with them. We used to meet with them twice a year. Either we'd go up there or they would come down here to meet with us. They just kind of like to check in and see how things are going. I think they were very pleased with our overall performance, especially these last 2 years were some of our best. And so, again, just some ongoing conversations with them. We again, in line with the parcel tax measure not going through and our push to begin looking at maybe ways that we might be able to do the upgrades internally through operations. We had some conversations with them after the meeting with regards to maybe some things that they might be willing to work with us on, either in terms of restructuring the debt or securing additional debt. Those would obviously all come back to the board. But they were trying to understand what it is we were trying to do. And so I'm very pleased at their response, that they're still very, very happy with the performance of the hospital and want to work with us in any way they can. So so we're going to continue on with that. We've got some conversations going back and forth right now, trying to collect some data and kind of get a better picture of what's possible with them. Devin Mathis was supposed to be out here for a visit on February 1st. Unfortunately, his schedule got changed. He will be here on March 1st instead. And so that is the day that we were supposed to have the open house for the pharmacy, so I'm hoping I'll be able to tie him into that. The purpose of that is we're renovating some things at the retail pharmacy, and we're trying to get, we have a new one of those drug disposal boxes that we put in, similar to what went in at the sheriff's station, that will be added to the clinic down there. And so the county actually wants to come up and hold an open house for us to announce that. So that's really kind of the purpose of that. Excuse me. So anyway, we will kind of confirm his schedule a little bit here and find out, what's going on, the things that we're waiting to get our remodel process completed there. We're striving the date. Also, just very happy to report that our clinic visits for the month of January were the highest I've seen in 11 years. We did 1,756 clinic visits last month. In comparison, December we saw 1,356, so 400 more visits. Commend the staff. It was a great effort. I think things are picking up in there, and so nice to see. I think so. I want to commend the staff up there and what they're doing for that and helping to promote that. So that's pretty much my report.
Okay. Any questions or comments for Mr. McGlue? All right.
Thank you.
Thank you, Tim. Item 5 is the Chief Nursing Officer report. Mr. Gordon, welcome again.
Yeah, this one I do get compensated for. So back in January, actually I think back in December, I reported on a sobering center being earmarked for our valley, and unfortunately I have no update at this time. I've been checking with Bill Walker down at Behavioral Health Services down in Bakersfield, and he just, they're building one down in Bakersfield. They have money set aside for 2 of these sobering centers. It's just kind of up in the air. So I'll probably take it off the agenda until I hear something else from him. But
May I ask a question
Sure.
about that? Does that mean that is the Valley in competition with, say, Tehachapi or
I wouldn't say competition. I think that because of the nature of where we are and how we're situated in the community, in the district and in the county, that's why he decided. Tehachapi has a direct line to Bakersfield. Right. Ridgecrest has a CSU or a crisis stabilization unit on its own. There are places up north of there. So really Taft and Delano, and they're all don't have the problems that we have with access, and I think that's why they chose us to receive that. I don't see them veering away from that. I just think there's going to be a delay in getting it up here. Unfortunately, the sobering center becomes the ER on occasion, so we're hoping that happens. We had our quarterly first responders meeting 2 weeks ago. Received good feedback regarding security issues. They're very supportive. The Kern County Sheriff's Office, very supportive of this meeting. I had LT Lieutenant De Leon here and Sergeant Frisbee were both here to discuss some of their issues that they're having with staffing and then how they respond to some of our issues. So it was a good meeting for us. They also had some suggestions and some feedback on our 5150 process. All of our 5150s who are reported or who come through the ER and are cleared they have to go to the CSU over in Ridgecrest now, so they've made arrangements for transportation for those patients. So the minutes from that meeting are pending. We've also implemented a new protocol to provide for the homeless population as a result of Senate Bill 1152 that became effective January 1st, 2019. I scrambled in the month of December writing a policy and was able to get that. I think that was one of the policies I mentioned earlier that did get approved, the aftercare instruction sheet for med-surg, and then there's also one for ER. They're essentially the same. But a lot of the recommendations came right from the California Hospital Association, and I literally pulled pieces off of that to put into our policy. And so now I've got people up north asking me for my policy, so. Anyway, so I think that we actually had one patient who fit that need, and we were able to provide that person with his weather-appropriate attire, with a lunch or a dinner. I don't remember what time of day it was, and then a bus pass to get him back to where he was going, back to Isabella. So we've purchased bus passes from our local service here, and we have to provide a ride for a homeless patient to his home. I know that sounds kind of contradictory, but wherever he calls home, wherever he lays his head is where he gets a ride to within 30 minutes or 30 miles. You'd be surprised if you went to a map and did a compass drawing of 30 miles, how far that reaches on the other side of Inyokern, the other side of Johnsondale, the other side of Walker Basin, and the other side of Glenville. So with us, it really is 30 minutes. I can't get to Glenville in 30 minutes, sorry. So anyway, we are obligated, and this is a unfunded mandate, so it's something that we're going to have to suck up and you know. I've also engaged nursing staff to look at new ways to focus on customer satisfaction and improving our scores from several years ago. We've got the latest scores we have are from fourth quarter 2017. No, I'm sorry, first quarter 2018. I think are the most recent scores we have. So they're a year old. So, but we do on a daily basis think about how to improve the scores and how to improve communication about medications, about discharge instructions, and those kinds of things.
And also in regards to your, you know, obviously reducing the treatment times in the ER and those kinds of things, the efforts you've been doing there have been very helpful, I'm sure, with patient satisfaction.
The clothing for the transportation, does it have to be new, or can we utilize?
We've actually gotten donations from the auxiliary to put into a bank, so we have sweats and we have jackets and shoes.
Yeah, we use the thrift shop.
They do not have to be new clothes at all.
Okay, good.
They have to be laundered.
Yeah, it got clean, but not.
Another opportunity is trying to reach out to improve those scores, trying to reach out to the patients before they leave and after they leave, trying to reach them at home to try to make sure they got to their follow-up appointments and they got their medications. We want to reduce recidivism and reduce that revisit, because that's one of those benchmarks that we're really looking at and focusing on. We're seeing multiple challenges with transfers out of our facility, and it's not necessarily the acceptance to other facilities, it's the transportation getting there. Liberty is really suffering with some staffing issues themselves. They have to really work on, you know, providing coverage in the valley when we send them out with a transfer, so they have to cover the valley when those go out. And if we have 2 or 3 in a shift, that really becomes a problem, because it's a 3-hour turnaround sometimes. Could be 4, could be 5 hours for a whole crew to go down to, if they have to go to Memorial, they get wall time down there that it could keep them out of the circuit for, you know, 2-3 hours down there, and then 2 hours of transportation time. So it really is a
They're
burden
not free to
for
leave
them.
until that patient's
That's
been
correct.
admitted
That is correct.
as a patient of.
It happens mostly at Memorial because they are so busy. Now, a lot of times we get an accepting physician and a bed assignment, so that makes it easy to, the crew just has to get on the elevator, go up to that bed assignment, they give the report, they get the patient over to the bed on the 5th floor, wherever they're going, and then they get to leave. But if it's going ER to ER, there could be some wall time there that really slows down that process. I did speak with Peter Brandon. He's the supervisor for Liberty. He's working really hard on recruitment. They're offering sign-on bonuses. They're offering transportation bonuses. They're offering a lot of different things, increases in pay, those kind of things to kind of really work on getting people up to work for him. So.
Could we provide some of the transportation?
It's a very good question, and we've actually had this discussion recently for BLS transports. Yes, we could.
Okay, because they have a non-compete, but they also have to perform, and they're not performing.
Let me just say this, the non-compete does not apply to a critical access hospital. If we wanted to have our own ambulance service, we don't have to ask permission for that.
Just means that Hall can't come up here, or AMR or some other company can't come up here.
But if we had our own, that would be a different story. As far as transportation, I think Peter would love us to do that, but it would relieve some of that responsibility from him. So we have had discussions about getting our own gurney van to be able to provide some of those lesser critical patients, to give them rides to places, transfers, in other words.
That sounds like it would be a good idea.
Yeah. So we're in discussion about that already. Also, the last thing I wanted to talk about, and I don't know if this is going anywhere, but I've been invited to give my presentation on the CSI Momentum program to the Western Health Alliance in Grand Junction, Colorado. I just don't know if that's going to come through or not.
We'll know more tomorrow.
We will know more tomorrow, but we'll see what happens. And that is the end of my report.
Congratulations on that. That's,
Yeah.
it's a
Are there,
nice compliment.
Yeah.
are there any other questions for Mr. Gordon? Mr. Pickering?
Can you elaborate a little bit more on what your sobering center is? Is it someplace people can come in off the street, or the sheriff bring in it, or?
Absolutely, yes. The sobering center is designed to reroute, and they can even accept ambulance traffic. If somebody's picked up downtown by ambulance, they don't necessarily need a medical clearance if all it is they're determined to be inebriated or under the influence. So it is a sobering center, and they have nursing staff that works there, or they have their own staff that works there. I'll say behavioral health staff. I don't know if they're nurses technically. We won't run that. It will just be a service that is offered by Kern County Behavioral Health. And you bet.
Any other questions for Mark? Okay, thank you, Mark.
You bet.
Thanks.
I don't see Chet Beadle, our CFO, tonight, so our controller, Barbara Figueroa, will give the financial report. Welcome, Barbara.
You love doing this.
You love,
I love it.
Yeah.
Chet apparently was held up in Lone Pine with some auditors, and so that's why he didn't make it back tonight.
Well, we don't get to hear from you very often, so.
And that's okay.
Quick.
Your financial report begins on page 18, and it is the page that shows all our volumes throughout the facility. We're also reporting on the month of December, ending in December, even though this is February. On the acute care, we had an average daily census for acute and swing beds of 4.0. Year to date, we're at 4.3. In the prior year, we were at 6.1. In the long-term care, our average daily census for the month was 56.6. The prior year was 63.4 for the same month. The ER visits during the month were high, 626. The prior year, they were 681, however. Outpatient visits, we saw 1,005 patients. Those are referred outpatients. In the clinic, as Tim mentioned before, they had 1,365 visits for the month in December. These statistics drive all our revenues and expenses for the month. So if you go on to page 19, does anybody have any questions on any of the statistics? No? On the following page is the current month report. Our revenues were $9,256,000. After our deductions, we had a total operating revenue of $2,228,000. Our expenses for the month were $2,324,000, and after our non-operating revenue items, we ended up with a loss for the month of $101,535. So the following page is the year-to-date. Year-to-date, that brings us to an operating loss of $478,000, and in the prior year, we had a positive $771,000. But volumes have been off in the last few months, so we're under. Does anybody have any questions?
Is that lost just for 1 month?
The 101,000 is, yes.
Yes. It's my understanding that we started off the fiscal year pretty strong, but
Yes.
in the past 3 months or so, we've seen a decline
Yes.
in visits, and that's
In
where
visits.
that's where that's coming from.
I think from a volume perspective too, Chet was indicating that January, he expects January probably to be a much better month, primarily
Good.
because the volumes were much more in line with expectation and so forth. So
Yes.
we'll see, when the numbers are finalized, we'll see how that shakes out.
So this is basically the month of December? Or
Yes.
Yeah.
Yes.
18, yeah. It looks like the skilled has kind of picked up a little bit from prior months, or?
It's been going up and down. They've been trying really hard to get more patients.
Okay. Because I know that's been a concern for several months now, but
Yeah.
you expect January
Yes,
to be
I know
better?
they've got, we just had a meeting about it this morning, and I know she's got several that, new admission possibilities that they're looking at. They're interviewing the patients and going over their medical records and so forth to see whether or not they're suitable. So we do hope that that will come up.
Are there any other
Questions for Barbara?
Then
Thank you, Barbara. All right, thank you, Barbara.
you're welcome.
We don't have any old business this evening. Under new business, this is legislation, which is an action item, AB 2329. Scott?
Actually, this is not an action item tonight.
Oh, it's not.
This is a presentation for the board and a question. So, for years, there has been a law in the water code that applies to all water agencies that allows board members to receive compensation for up to 6 meetings a month with a max compensation of $100 a meeting that increases annually at 5%. Now, that law has only applied to water agencies up until this year. And this year, the legislature passed AB 2329, which now applies that same law to, amongst other districts, hospital districts. So the law requires that if the district desires to change your compensation structure, that you adopt an ordinance which would take place over 2 meetings, would be published in a local paper, and that ordinance would say that right now your compensation is 5 meetings a month. So you would continue to receive the compensation for the 5 meetings, and if the board found that it was necessary to do a 6th meeting, then the board could vote to allow compensation for a 6th meeting. For 2019, your compensation would remain $100 a meeting, and then starting in 2020, that would go up 5%, and every year thereafter, it could go up another 5%. So the question is, would the board like to do this? Would you like us to come back next month with a proposed ordinance that you can look at? Or how would you like to handle this new law?
What does the
It's my opinion that we should study this rather than just decide to do it tonight about something, yay or nay tonight. This is the first I've heard of this. I don't think we've had it in any committee meeting. I think we should have more information before we make a decision.
We're not taking action, right?
Nope,
Okay.
no action tonight. We don't have anything for you to vote on. We have to go through the ordinance process, publication, public hearing, the whole deal. So the question really is, it's just a presentation of this new law exists as of January 1, and would you like us to come back with a proposed ordinance for your consideration?
Yeah, we should look at it, if there's a benefit or not a benefit. We
Okay.
should know what we're doing.
Right.
Absolutely, then we'll do that. We'll have it for the March meeting, and we'll get it out to you so you can look at it. And then if you decide to proceed, then we would have a first public hearing of March, and then we would have it for approval on the April agenda.
Is there advantages or disadvantages? It looks like it's good the way it is, but, without looking at it.
Yeah, so what it does is, so this is my opinion from representing government agencies for 22 years. Directors who are very committed to their job and put the effort in are drastically undercompensated for the work they do, for the time and the effort that they put in. And if you were subject to the minimum wage laws, every agency in the state would be violating it. This does not change that much. So 5% a year off $100 is not a great increase. But I think as several years ago when the legislature did this for water agencies, they recognized the effort that these boards put into other agencies and the time, and that in any realistic world, you're not adequately compensated for the work you do. But this is an opportunity to increase that limit from $100 a meeting. Again, it's incremental. This is not a huge jump. You are not going to retire.
Yeah.
Off of
we don't want to be like the city of Bell. I mean,
Yes, we're not going to be like the city of Bell, but you're not going to retire off of the compensation you receive as directors, but it's an acknowledgement of the effort that you put into the job.
So we wouldn't have to work harder.
You guys already work hard.
My question would be that if hypothetically, if we adopted such a policy, does it become automatic, or do we vote as a board year to year
Well,
as to whether or not we want to, hike it up?
Sure, so the ordinance would be automatic, that there would be an annual increase.
Okay.
But the board is always welcome to vote on its compensation at any point in time and change it. Lower it, you can't increase it, right, but you could
I understand.
refuse the increase, or sometimes agencies change the amount. They might be low and raise it up to the max, or they might be at the max and lower it. You always have that freedom.
Gotcha.
So,
Thank you.
Dr. Montez, do you have any input? Or
Not right now.
is there any input from the public?
okay, then Heidi
I
will
guess
be sure to have that on the March agenda.
Yeah.
Perfect.
The consensus of the board is to come back next month and explore it more.
Well, can we get information we could look at prior to him coming back? I mean,
Yes.
so like email us the actually.
Like a week or two.
The legislation you mean?
Yes, yes.
Yeah,
Yep.
okay. Item H is director's comments not appearing on the agenda. We'll start with Director Montez. You
I
have anything?
have no comments at this time.
Okay. Director Bush?
I would just like to say, because for public perception, I know that in Barbara's report, we showed a pretty desolate picture for December, but I, once again want to point out that for the fiscal year of 2017-18, our audit report that came out showed that the hospital, the healthcare district, had its best year in its history. So I think that everybody's doing a wonderful job. Proud to be part of it. But that's it, and we'll just keep our fingers crossed that things pick up. I think that, and I compliment you, Greg, on all the work on the mobile, because I think that's going to be it's going to serve this valley in an incredible way, and so it'll fill in a lot of holes.
Okay. Thank you, Director Bush. Director Parks, anything?
From going to the meetings, the finance meeting and the planning meeting, it seems like we're moving into a very good direction. We're able to pay for ourselves for not expansion, but at least retrofitting, and pay as we go, sort of, is what it seems like, which is a good way to do it. And so it seems like we're moving forward in a very positive way since the defeat of Q.
Thank you, Director Parks. Director Cassis?
I have
anything?
nothing to say.
Okay. I don't have anything except for thank you all for coming out this evening. Just a side note, I did read in the newspaper that Ron Bolliard passed away, and I know he was really involved with the foundation for a lot of years. That he was a really nice man and very hardworking in our community. With that, we are adjourned at 6:55, 6:53. Four.